Let's bring in Republican North Carolina Congressman Mark Walker. He's also a member of the Homeland Security Committee. Congressman, you wrote to Homeland Security this week, and you said one of the things you're most concerned about now is disinformation coming out of China. Tell us about that.
Yeah, we understand their history. Even Pompeo referred to this as the lack of information and sometimes disinformation. In fact, just in February, they had told us that some of the cases had been trending downwards, and then we find out that it had actually spiked to more than 15,000. This is China's history. We appreciate what they're sharing, even in terms of adding some revenue or some money to help alleviate this coronavirus, but we always take it with a grain of salt. The other thing, as ranking member of Intelligence and Counterterrorism, we also have to watch the southern border. When I was down there months ago, in one calendar year, we were able to apprehend more individuals from more than 60 countries. Just this year alone, we've been able to apprehend more than 300 Chinese nationalists. So we have to make sure that our borders are secure more time than ever, knowing who and what is crossing.
Now, when you say that you take the Chinese government's numbers with a grain of salt, are you really saying that you think they're lying or that they're covering up the real numbers that the government knows about? Or are you saying maybe they're, not fully competent to give us a good reading?
Oh, I think they're fully competent. I think that for history, even decades, is China's first instinct is to create disinformation without getting in too much of the weeds, stealing our intellectual property. We just don't always know exactly what the truth is coming out of China. Again, I can tell you on the Homeland Security, China attempts to hack us 15 to 20,000 times per day through cyber attacks. So anything that comes out of China, we always take it with a grain of salt.
Have you talked to anyone at the White House about this concern, and what are they telling you?
Well, I think the White House is very much aware of it as well when it comes to personal phone hacking, all the different things that China's main goal is to become the one major superpower.
On coronavirus specifically, have you talked to the vice president or anyone on the task force about, your worry here that China's pumping disinfo about the virus?
We have, and there are some concerns. We are trying to move cautiously forward with China. We believe that we are getting to a better place. Let me add that. I don't want to create more alarm or more fear here, but I think it stands for good record. Historically, we have to be monitoring the information that comes out of China. Had there not been disinformation coming out from the first place, we wouldn't be behind the curve like we are today.
Now, in your state, sir, I believe there's 2 confirmed cases now of people who have the virus. Is that right? That's the latest?
That's correct, Gillian. Yes.
So yesterday, the vice president, in his briefing, pretty much conceded that the U.S. government doesn't have enough tests. He said, this is a verbatim quote, "We don't have enough tests today to meet what we anticipate will be the demand going forward." Now, for days, the vice president in multiple briefings had been saying any American can be tested at any time. How do you square that?
Well, I believe the contradiction or seemingly contradiction may have been those that are in situations where we feel like there is evidence to support a test as needed versus widespread testing. I think that companies and manufacturers are trying to get it where anybody who wants a test can have one. But I also want to make this point, Gillian. This is a huge concern. We are in a preparation mode. But just last calendar year alone, we lost 34,000 folks to influenza, to the flu bug. We've had 16 deaths so far. It's too many. I get that. But we want to make sure that we're taking all the precautions we can, but not create a level of fear or panic that is unjustified at this point.
Well, sir, public health officials here in the U.S. and epidemiologists all agree with you. They say there's no need to panic. Panic can actually end up making Americans much less safe when there's an outbreak, if there's an outbreak in their community. But at the same time, the key here, according to officials, is to do everything we can to prevent as much spread as possible. So from that perspective, people need to not panic, but they do need to be prepared, right? So that we don't see, tens of thousands of elderly people dying in the spring, which is the numbers they're forecasting.
Gillian, that's an excellent point and observation. Here in North Carolina, I liken it to a hurricane that's just off the coast. It hasn't hit land, but what we're trying to do right now is to prepare to make sure that we can absorb it with as little damage as possible.
Well, Congressman, thanks so much for your time today. We're wishing you the best, thinking of, the patients with confirmed cases in your state, and we really appreciate all of your time today. Thank you.
Thank you, Gillian. Thank you.
Leland.